Welcome. I want to welcome you all here today. Thank you so much for coming out for this great event. Before we get started, we'd like to just say that our hearts and prayers are with everyone in Texas and Louisiana affected by Hurricane Harvey. We are so glad you all could be with us today. We have an exciting afternoon planned for this grand opening of HealthRIGHT360's Integrated Care Center, right here in the Mission District of our fabulous city and county of San Francisco. HealthRIGHT360's clients are now able to receive comprehensive treatment services under one roof: primary medical care, dentistry, mental health services, substance use disorder treatment, housing referrals, employment opportunities, adult education, as well as a dining room and a pharmacy. Before I tell you who I am, I want to tell you a little bit about who I was. At 28 years old, I moved to San Francisco on a one-way plane ticket. I was sober just over 3 years at the time, and an event in my personal life had triggered a depression episode and my subsequent relocation across the country. In recovery, we call that a geographic. Thank you. I was lucky enough to get a job within 2 weeks of arriving, but it was an hourly without any benefits. With a dual diagnosis of substance use disorder peppered with depression, I knew I needed to maintain my health on all fronts. But how could I do that without insurance? Lyon Martin Health Services was there to support my medical well-being and maintain my antidepressant medications. Haight-Ashbury Free Clinics was where I turned for ongoing outpatient support groups. The sliding fee or free, non-judgmental, culturally sensitive care I received allowed me to maintain stability in my life. Lyon Martin Health Services, Haight-Ashbury Free Clinics have since come together with Walden House, Asian American Recovery Services, Rock Medicine, and all the others as programs of HealthRIGHT360. Which brings us back to today. My name is Trisha Walsh. I'm a sober addict alcoholic and a depression survivor. I am also the board chair for HealthRIGHT360. Thank you. In those days, I never would have thought this was possible. Like a former upstairs, Ben? Anyone? Bueller? Good afternoon. Good afternoon, everyone. Better? Closer? Closer? Right at me? Yes. Excellent. Good afternoon, everyone. Welcome. I want to welcome you all here today. Thank you so much for coming out for this great event. Before we get started, we'd like to just say that our hearts and prayers are with everyone in Texas and Louisiana affected by Hurricane Harvey. We are so glad you all could be with us today. We have an exciting afternoon planned for this grand opening of HealthRIGHT360's Integrated Care Center, right here in the Mission District of our fabulous city and county of San Francisco. HealthRIGHT360's clients are now able to receive comprehensive treatment services under one roof: primary medical care, dentistry, mental health services, substance use disorder treatment, housing referrals, employment opportunities, adult education, as well as a dining room and a pharmacy. Thank you. tell you who I am, I want to tell you a little bit about who I was. At 28 years old, I moved to San Francisco on a one-way plane ticket. I was sober just over 3 years at the time, and an event in my personal life had triggered a depression episode and my subsequent relocation across the country. In recovery, we call that a geographic. Thank you. I was lucky enough to get a job within 2 weeks of arriving, but it was an hourly without any benefits. With a dual diagnosis of substance use disorder, peppered with depression, I knew I needed to maintain my health on all fronts. But how could I do that without insurance? Lyon Martin Health Services was there to support my medical well-being and maintain my antidepressant medications. Haight-Ashbury Free Clinics was where I turned for ongoing outpatient support groups. The sliding fee or free, non-judgmental, culturally sensitive care I received allowed me to maintain stability in my life. Lyon Martin Health Services, Haight-Ashbury Free Clinics have since come together with Walden House, Asian American Recovery Services, Rock Medicine, and all the others as programs of HealthRIGHT360. Which brings us back to today. My name is Trisha Walsh. I'm a sober addict alcoholic and a depression survivor. I am also the board chair for HealthRIGHT360. Thank you. In those days, I never would have thought this was possible. Like a former ad campaign you may recall, I'm not only the board chair, I'm also a client. HealthRIGHT360 was here when I needed them. In 2012, nearly 20 years after my arrival, I had the opportunity to join the Lyon Martin Board of Directors, and I jumped at it. The merger in 2014 then led me to the HealthRIGHT360 Governing Board. It has been an honor to be in service to this organization and to the clients and the communities we serve. HealthRIGHT360 provides health care to underserved populations, uninsured pregnant mothers, the homeless, HIV positive, Hep C afflicted, prison inmates, substance use disordered, and those dually diagnosed regardless of their ability to pay. To get better, do better, be better. The purchase of this building and the creation of the Integrated Care Center would not have been possible without the vision, dedication, and leadership of HealthRIGHT360 CEO, Dr. Vika Eisen. Please help me welcome Dr. Eisen.
Thanks, Trish. I, too, am a former patient of Haight-Ashbury Free Clinics and former client of Walden Houses, and I do really want to acknowledge we are lucky to have the founders of both of those two legacy organizations in the room, so I do want to acknowledge Dr. David Smith and Walter Luttrell, the founder of Walden House. I truly owe my life to those programs as well. So I want to thank you all for joining us at the grand opening for our newest facility today. We are honored to have you here with us today, especially our leader in the Congress, an enduring fighter for health and justice, Leader Pelosi. And of course, the mayor of this fine city, Mayor Ed Lee. Now, this space represents HealthRIGHT360's ideal for fully integrated care with services including primary care, a dental clinic, outpatient substance use disorder, and mental health treatment. We have a pharmacy that's right behind us. Our resource center, those have services that address the social determinants of health. And our central intake assessment and placement center for our San Francisco residential programs, where we house 500 people every night in either a substance use disorder treatment bed or a recovery housing bed in different locations around the city. And the access point for those beds is right through that door. Now I want to talk a little bit more about our dental program because I'm really excited about it. And if you knew me, you would know that dental and excited are words that are not usually found in the same sentence. But I think we all know that good dental health is linked to improved health overall. However, we see dental care as so much more. We see it as an investment in independence and human dignity. Like we say around here, it's hard to get a job if you got no grill. We want our clients to be successful in gaining employment, and we want parents to attend their child's parent-teacher conference without shame or embarrassment about their teeth. And we want to manage dental pain in a compassionate and responsible way. This is just one way in which our services were designed with a great deal of reflection and intentionality. This facility represents our vision for truly whole-person care. It's the jewel of the safety net, offering a path to health and vitality for the people we serve. It also stands as a beacon of hope and a reminder that there is still a place in the heart of San Francisco for those who have been relegated to the margins, individuals and communities that live at the very center of the soul of HealthRIGHT360. May this facility also serve as a shining example of the true spirit of San Francisco, with the city's long-standing and historic commitment to serving as a sanctuary in the greatest sense of the word for those fleeing war, despair, and hatred for their race, gender presentation, and sexual orientation. Of course, a building is just a building. It's concrete and steel, sheetrock and pipes. And visions are really just exercises of our imagination. It is the people inside the building that make it a place of healing and of growth. It is our staff's compassion, creativity, love, commitment, integrity, humor, and spirit that draws our clients in and welcomes them. So I want to really acknowledge our staff. Yay. And it is also our clients' resilience, courage, potential, and power that just lights up this building. It's also our many supporters that have helped us make this vision a reality. First of all, I want to acknowledge our individual donors whose generous gifts helped us secure their location. The names are on the wall right there, over right there. Many people right around that corner of the red wall. And that's a temporary wall. It's going to be a really nice donor wall there. And then, of course, our neighbors and our healthcare partners, Kaiser Permanente and Sutter CPMC, whose generous contributions help support the facility renovations. And, of course, the many financial institutions that joined together to finance the project, including Bank of America, the Nonprofit Finance Fund, and all of our nonprofit New Market Tax Credit partners, all of whom participated in the complex financing needed to bring this facility to life. And while a project like this is a major undertaking, requiring many different individuals, city services, and companies to come together to bring it to life, I have to give a shout out to my friend and a lifelong champion of healthcare for low-income people, San Francisco's Director of Health, Barbara Garcia. From helping to facilitate the merger of Walden House and Haight-Ashbury Free Clinics, which was really the seed of this facility, and those are the legacy programs that became HealthRIGHT360, to helping us negotiate the hurdles and obstacles that go along with developing a project of this size and complexity. Director Garcia continually demonstrates her commitment to innovative care to improve the health of this community. Finally, our mayor, Ed Lee. In these challenging times where the forces of hate and white supremacy and transphobia and a blatant disregard for the health of low-income people is on the rise across this nation, our mayor stands fast, protecting San Francisco as a place where all are welcome, immigrants and entrepreneurs, refugees from all sorts of trauma and oppression seeking safe haven. Mayor Lee, thank you for your leadership and support, and let me welcome you to the podium to say a few words.
Thank you, Doctor, and thank you, Trish, and the entire Board of Directors. Congratulations. Congratulations for this. And I'm really happy to join our Director of Public Health and certainly Supervisor Sheehy, who's fast become our resident expert on the Board of Supervisors for all health-related questions. Thank you, Jeff, for being here. That means be short. I am excited. I'm excited to, of course, join our leader and to just take a moment to thank everyone for putting this together. I was here just a short months ago when we first did the first hit. I don't know if we broke a hole in the wall or if we did dug a hole. But I was excited at that time because one of the things I've learned in my hours of talk with our public health experts is the concept of whole person care. And it isn't just the reaction that we have that we're good at in treating the emergency person who walks in to SF Zuckerberg General, but it is in terms of prevention, in terms of sustainability. It's all the things that will happen in this roof here at 360. And I want to say congratulations, because you're going to be the prime example of how we treat people who can't afford it, how we make sure people who are on the streets get the best care possible so they can transform their lives, as you have testified in your own lives. This is what San Francisco is all about. This is why a city that leads with love and compassion will always succeed better and faster than any other place, because we begin with our hearts, and then we put our minds and our money together. And we wouldn't be here. I wouldn't be aspired to do the kind of work that I do as mayor unless I had the examples at the federal level, watched them, and how they inspire me to fight harder, fight better, be smarter about everything that we've done. And someone that I have the privilege of introducing, but I will say to you, it's been a personal blessing, Leader Pelosi, to be a city that you love and admire, that demonstrates every day how we can do it and do it well, and be the examples for all the other cities, states, and federal administration, how we can be a successful place when we really treat our residents with dignity and with pride. Leader Nancy Pelosi.
Thank you. Thank you very much. Thank you very much, Mr. Mayor, for your leadership and for being a model mayor to the country. When we talk about San Francisco in Congress, from time to time, people will say to me, well, it's so easy for you because San Francisco is so tolerant. And I say, tolerant? That's a condescending word to me. It isn't about tolerance. It's about respect. It's about taking pride. And our mayor takes great pride in our San Francisco values, our San Francisco people. Thank you, Mr. Mayor, for your tremendous leadership. Dr. Eisen, thank you for your leadership. You, again, are an example to the world of success, and anyone who comes here and knows about you is given hope. So thank you so much. And Trisha, thank you for your example as the chairman of the board, as one who is still, shall we say, has a relationship with it. HealthRIGHT360, full circle, continuum of care. People in this room making that happen. Walter, David, Supervisor Sheehy, Director Garcia, my friend John Gresham, wow, what a guy. Thank you so much for your leadership as well. But I could name so many of you who have taught us so much over the years by your courageous leadership. It is a HealthRIGHT. HealthRIGHT. Do you just love the name? Because we do believe that healthcare is a right for all people, not a just something for the privileged few, and you respect that. When you tour the building and see the beautiful infrastructure, you see the respect and the pride that you take in your patients. When they come here, they feel respected. And that is a very healthy thing. And also the human infrastructure that is here in terms of healthcare professionals who treat them, that is also another sign of respect. And we learn from them. Being a teaching facility as well, we learn from the beautiful diversity of San Francisco in terms of the honor that we have to treat all kinds of different people from all different places. So I'm very excited about this. I mean, David's been teaching me for over 30 years in the Haight-Ashbury Health Clinic, and Phyllis and Del, Phyllis Lyons and Del Martin, they were our mentors for decades as well, and to see all of this coming together in a synergy that is so far beyond the sum of its parts is something quite remarkable. And so it is, again, we're in a fight on the very principle that healthcare is a right, not a privilege. Martin Luther King said of all of the forms of inequality, the one that was the most stunning and damaging was that of inequality in access to healthcare, because people could die. People could die. And decisions that are made in terms of public policy make a difference as to whether people live or die. But in terms of health, the good health of America, in addition to health care, the good health of America, the prevention, the wellness, even what you do as far as dental, what you do, well, it's remarkable, right? We just said we had never seen anything quite like that in our own dental experience, right? All of that just improving the health, in addition to the health care that people have. But it's a funny thing. I mean, funny, I don't mean funny, ha-ha, I mean funny, peculiar thing, that everybody doesn't see it that way, and that we have to have a fight to say, oh, we have a bill, it's going to take 22 million people off of health care. That's our health care bill. Oh, really? Oh, really? But we are prepared to fight that fight, and we are fortified in it by what we see here from all of you, that we can say this really works. And as we go into, and we took pride learning many of the things that we did in HIV and AIDS and all those sprang from San Francisco, community-based care, prevention, research, and the rest. And then that beyond HIV and AIDS was part of the Affordable Care Act, but also in terms of what we've done is mental health parity issues in terms of mental health parity, including alcoholism and addiction. This is to treat that as a diagnosis rather than a crime is something really essential to health care in our country. And so I thank you, Andy, thank you for what you're doing in terms of opioids and the rest, because now we have an opportunity, ill-gotten opportunity, but nonetheless an opportunity, because it is affecting every district in the country. They can't say, well, it's just LA and San Francisco and New York and what. Every district in the country. So we have to see the sadness of the opioid epidemic as an opportunity for the country to copy what you are doing here. It's so fabulous. Now, Mayor, you talked about digging a hole or something when you came here the first time. Well, David and Walter and others, they've been breaking ground for a long time. But what we see here today is you broke ground. You did not leave it broken. You have built upon it. I'm very honored to be here. It's all a joy to see. Now we're going to cut a ribbon, are we?
We're going to cut a ribbon.
We're going to cut a ribbon. We're going to cut a ribbon. Thank you all very much. So this is about what?
We're going to take